Fainting is a temporary loss of consciousness due to an insufficient supply of oxygen and therefore blood getting through to the brain. There are lots of different reasons why someone might faint. One of the most common ones is changes in temperature. This often happens when someone comes out of a hot sauna into the cold air. During that change, it naturally causes blood to fall out of your head, and as a result, someone might faint or collapse to the floor. Alternatively, lack of food, dehydration, or any form of physical exhaustion, such as standing for long periods of time, may also result in someone fainting. When someone does faint, the signs and symptoms are fairly obvious. First of all, you might actually see the person collapse to the floor and they'll be unresponsive on the floor for a short period of time. Alongside that, they're likely to have pale, cold skin, their pulse is likely to be slow, and you can also sometimes get some moisture on the skin, some sweating as well. In terms of the treatment for fainting, it's also relatively simple. Fainting is usually quite harmless. It only usually causes a problem if the fainting has caused a secondary injury, such as a head injury, when the person actually collapses to the floor and they hit their head onto the floor. In terms of what you need to do, the first thing is that you should keep the person lying down on the floor. You don't want them to get them to stand up suddenly or to sit up. You should keep them lying on the floor, and we want you to raise their legs. You could do this by putting it on an object such as a chair, as you can see in this picture. Alternatively, you could just hold the legs at sort of knee height for a few minutes. If the casualty does not recover within 2 minutes, then at that point, you should roll them into the recovery position, as we talked previously, and you should call the emergency services. Usually, what happens is you raise someone's legs, and within about 30 seconds, they tend to come back round straight away. But if they haven't come back round by that 2 minute mark, then that's the point at which you want to choose to call for an ambulance and put them into the recovery position. Alongside this, whenever someone's fainting, it's a good idea to check for other injuries. As I mentioned before, head injuries are very common when someone faints, as they're likely to hit their head on the floor when they collapse to the floor. So check for other injuries and treat appropriately. This might mean that you need to take someone to hospital because of the secondary injury that's occurred. A final thing that's good to do is just make sure that the person has plenty of fresh air. It's good to just help calm the person down and clear their head a little bit as well.